Minimally invasive heart surgery is picking up in the world. What it means is we do heart surgeries through smaller incisions than before. Normally, as we all know, when we do open heart surgery, we cut the breastbone with about 8 to 9 inches incision, then spread the bone and then go and do the surgery. It takes about 3 months for the incision to heal, and there are a few complications like infection of the mediastinum and then bone infection. And during these 3 months, people cannot drive, have to take rest, cannot do heavy work, etc. And when we do a second operation, some of these patients do require second, third operations. Then there will be a lot of difficulties in approaching the heart. That is a standard surgery. In minimally invasive heart surgery, we do not cut the breastbone, or we cut only a part of it. The rest of the bone is intact, keeping this stable. Or sometimes we give an incision on the side of the chest. For the right side, if you have to do valve operations or closure of holes in the heart, and on the left side, if you have to do bypass surgery. Below the nipple, we give about 3 to 4 inches incision. In between the ribs, we go inside and do the surgery. So in minimally invasive surgery, the incision size is smaller. Most of the times, we do not cut the breastbone. And in some situations, we can do the surgery without using heart-lung machine. So when these criteria are met, one of more, we call it as a minimal invasive surgery. The advantage for the patient is they recover faster in a shorter time. They can go back to the work in about 4 to 6 weeks' time. Pain is less, transfusions are less. Now, what are the surgeries that can be done these days through minimal invasive heart surgery? Most of the surgeries can be done. For example, valve replacements, mitral valve replacement, aortic valve replacement, and closure of holes in the heart. And again, bypass surgeries can be done this way. If there are tumors in the heart, we can do those surgeries. So many of the surgeries that we are doing regularly through the sternotomy can be done. However, we need to be selective in doing these surgeries on patients. We cannot do this on every patient. We make sure that there are no major problems. There are not too many surgeries are involved in this patient. So we have a certain selection criteria for a success of the procedure. So next time you go for a heart surgery, to either to you or to your family members or friends, please ask the surgeon if this procedure can be done through a minimal access approach.